Hello, my name's Emily. I'm here to talk about parents' perspectives on conflict in paediatric healthcare, written by myself and my colleague, Professor Anne-Sophie Darlington at the University of Southampton. And we're really pleased to say it's actually just been published in Archives of Disease in Childhood. So why are we interested in this topic? So we know that advances in healthcare technology are meaning children are living for longer with more complex comorbidities, and the risk of conflict is high when there's prognostic uncertainty. Conflict often occurs also when we're discussing withdrawing or withholding life-sustaining treatment. Well-known cases include Charlie Gard, Alfie Evans, Asher Keane, for example, that all made international news and literature. Conflict is really damaging to patient care and can have long-term impacts on the family. It's also really detrimental to professional well-being and morale, and very costly to NHS resources. So current research is ongoing in conflict in paediatric healthcare. Forbat et al. Reported causes of conflict from healthcare professionals' perspectives and found these to be summarised by communication breakdown, disagreements over treatment, and unrealistic expectations. However, the parent voice is often lacking in current research. So this review aims to explore the parents' views on conflict from the literature and map these onto those identified by healthcare professionals in Forbat et al. So we completed a scoping review, identified 512 papers, and included 10 for formal review. We extracted information on conflict and disagreements and then used thematic analysis to identify the following themes. So first of all, I'd like to talk about the circumstantial factors that they're highlighted here in yellow. So parents identified some causes that might not directly lead to conflict, but can leave them vulnerable to communication breakdown, for example, particularly exhaustion, which intensifies feelings of grief and anger and confusion, and also a difficulty retaining complex medical facts. And they find it easier to recall observational information. So while these do not directly cause conflict, but it leaves parents vulnerable to conflict and disagreements. They also discuss communication breakdown. So poor communication style can often lead to conflict, particularly untimely or abrasive communication. Parents reported also when they felt unheard, they'd feel a lack of control, and that could often lead to conflict. They also, interestingly, wanted to be recognised as their child's experts. So for some parents, this was acting as a translator for their child, which may include children who've got non-verbal communications or complex conditions. They also recognised that disagreements over the futility of treatment in particular was an area for conflict. They feel influenced strongly by their own observations as opposed to sort of clinical tests and medical facts, if you like. And parents also felt, interestingly, that healthcare professionals are trying to protect them from the burden of decision making, which to them would feel like they were losing focus on the needs of the child. And similarly, the understandings of best interest seem to be different between parents and professionals. So parents believe that professionals are considering the wider family's needs when making recommendations, but parents want the child just to be the sole focus of this. Trust was an element that was discussed frequently. So parents recognise that they need to trust their professionals during times of uncertainty, and then new clinicians can be really challenging to trust, emphasising the importance of continuity of care where possible. But they also drew attention to the impact that previous experiences can have on their likelihood for conflict. For example, previous mistakes in healthcare or perceived lack of understanding of their child's unusual conditions. And this feeds on to the importance of advocacy for parents. So all parents felt they need to advocate for their child, but particularly parents of children with additional needs. They often feel they need to fight for things on a daily basis, even the little things. So for them, it's even more important to trust that their professionals are going to provide what their child needs without them having to fight for it. They also discuss spirituality as something that impacts on their approach to decision making. They also feel that this is something that professionals do not necessarily take as much understanding of. So we were interested in particular with suffering as well. So there were disagreements that occur over the extent to which the child is suffering, but also the degree of suffering that is acceptable is variable between different families. So some parents would also link suffering to religion and spirituality. So some parents' suffering was part of God's plan and something they didn't feel should be intervened with. Parents also discussed types of decision making, including whether they're intuitive or rational decision makers. And they indicated that their perception of shared decision making is being persuaded to the clinician's point of view. And they also reiterated the stress that is involved in making decisions under time pressures, perhaps under acute deteriorations, for example. So we're mapping these on to the findings from healthcare professionals. So in the dark blue here are boxes from Forbat et al. That professionals have identified as causes of conflict. So we can see there's similarities between professionals and parents, particularly communication breakdown. They talk about abrasive, untimely communication, and disagreements over treatment, particularly surrounding futility of treatment. But we can also see there are differences and nuances provided by parents that might not be currently recognised by professionals. For example, no parents identified unrealistic expectations as a cause for conflict. So the things that we really learned during this project is that a lot of these things seem to be related back to parental roles. So parents feel it's part of their role to be their child's expert. This can lead to feelings of fear, helplessness, and stress if they feel that this expertise is being challenged. That in itself will then possibly make them vulnerable to communication breakdown. Similarly, challenging their expertise can make them mistrust their professionals, which in consequence can also lead to conflict. Professionals and nurses in particular can encourage involvement in care to help parents feel that they're achieving their role and respecting their expertise. Many of our parents will be completing really complex technical care at home on a daily basis, and then they get admitted to hospital and these things are removed from them. So this might be a sort of practical thing that we can do to help parents retain some control and feel like they're achieving their role. As we discussed earlier, suffering is also another point of interest. So we know it's subjective and it's really challenging to assess the level of suffering for parents and professionals, but also that the suffering is acceptable to a different degree for different families. And suffering is so integral into making decisions about what treatment is offered to parents that actually it's really important to understand what perspective everybody is coming from before trying to make a consensus decision. And equally, the perceptions of best interest. So as professionals, we may consider the interests of parents and the wider family and want to protect the parents from any guilt associated with decisions, but parents will feel that that might be a distraction from focusing on the needs of that child. I think it's also important for professionals to consider a family's approaches to decision making. How do they approach every decision they make? And can we acknowledge some of the psychological biases in information processing? So how much easier it is to retain vivid, tangible observations of a child as opposed to maybe some more medicalized information that we would be presenting. So it'd be really useful to know for each individual family what information is of most concern to them, so we can provide it in a manner they can access it to help us all reach a consensus. In conclusion, the review demonstrates the complexity of conflict from a parent's perspective. Parents have shown they want greater understanding of their role of being a good parent, and professionals need to understand the importance of advocacy and parental expertise. But also, this means different things to different people. Professionals would benefit from skills to ascertain parents' perspectives on suffering, best interests, and decision making, while taking into account their previous experiences. This could help remind everybody of their shared goals and aim to reach a consensus. But this review is clearly just the starting point. Healthcare is going to continue to become increasingly complex, and further research into the dynamics of conflict in health is vital. Thank you for listening, and I'd like to thank my colleague, Professor Anne-Sophie Darlington at the University of Southampton, and also Andrea Swan and Vanessa Everett, who are my ward sister and matron at work that allowed me the time to work on this project. Thank you.